So it's important for us to realize that midwifery was decimated in this country when we ended grand midwifery, which black women were birthing babies around black and white babies when this country was founded. And so undoing the racism and the harm means us acknowledging that and ensuring that we have a full spectrum of access to birth workers. Doulas provide social support and safety. My colleagues as OBGYNs, we understand that when it comes to high income patients, we expect them to have social support. But what we have not been able to grapple with is the need and the desire for people who are less centered to have social support, and sometimes that we are not capable, or we've not gotten to being able to appreciate how that's important as well. So it's important for us to be able to broaden our view and make room for all the people who support birthing people, and we recognize that birthing people want doulas and midwives. And every other country that has better birth outcomes than we do, that's who delivers those babies. And so instead of us, we know we have maternity deserts, so it's not a fight, it's not pie. There's room for all of us. We need more black doctors, but we also need more black midwives and more black doulas.
Thank you, Dr. Crear-Perry. In fact, a study published in the Journal of Perinatal Education, Perinatal Education, found that people who use doulas were 4 times less likely to have a low birth weight baby and 2 times less likely to have a complication. Dr. Taylor, maybe I could turn to you. How could access to these resources improve outcomes specifically for Black birthing people?
Sure, absolutely. I mean, you've already gone over the stats. I mean, for Black birthing people, having access to doulas and midwives is essential, particularly if those doulas and midwives look like them. Research also shows that for doulas and midwives that focus on having care models that center their patients and their lived experiences, they have better birth outcomes. And so this also means we've talked a lot about today, ensuring the pipeline of a diverse workforce. And so that means we do have to make sure that we're creating opportunities, particularly for people of color, to be in those professional pipelines, to get their certifications, to get their trainings, and to get the education that they need in order to support Black families and meeting them where they are. And most times they are the ones that are on the front lines, meeting their needs. Again, that is consistent with their lived experiences.
Thank you. One of the things many of us believe in this body is that we need universal health care, we need Medicare for all, we need equal resources. But what I'm hearing from you and some of the panels is that that's not enough to deal with racism, that even if you have healthcare as a human right, even if you have Medicare for all, even if you have everyone having the same amount of access to doulas, you still have a problem of race. You still have a problem of discrimination that's leading to disparate outcomes. I wonder, Dr. Taylor or Dr. Crear-Perry, if you could talk to us about what we need to do as we craft a Medicare for All bill or other bills of universal healthcare to deal specifically with the issue of race.
Well, I can start. Yeah. Oh, go ahead, Dr. Perry. Crear-Perry.
Oh, I'm sorry. I was just going to say that you can never do race-neutral policies to end racist policies. So we created Medicare and Medicaid in a racist strategy. Medicaid is a states' rights issue, and you see that play out over and over and over again. So when you do Medicare for all or any kind of universal health care coverage, you have to actually explicitly undo the racist harm that's currently being done by the current policies that we have.
Dr. Taylor, did you have any comment? And then I think my time's up.
I would just say I agree with that. I think you said it precisely. Coverage is not enough. So, my opinion is that we need to not only fix our healthcare policies and ensure that healthcare is accessible and affordable to all families, we also need to address the racism that is systemic within every structure in this country. And that is going to have to go hand in hand with the fixes for health insurance.